This segment has to do with radiation incidents. We want to secure and respond to this type of hazard. What is my role as a security personnel? Well, I must control access, allow the mobilization of government vehicles to the decon area, the safety of the environment, provide the 3 lines of defense, and reroute the victim's relatives with respect, empathy, and care while staying firm on the regulations. Now, what should we consider for a response? How many victims are there? Who are the victims? Are there injuries? How serious are they? How bad is the contamination? What is the path of contamination? Is the contamination internal, external, or both? What is the contamination path? Is it through inhalation, ingestion, or penetration? What is the source of the radiation, and what is the degree of exposure or contaminant? In order to protect ourselves, we need the personal protective equipment, PPE. It requires a cap, eye protection, mask, a scrub suit with a gown, 2 pairs of gloves, tape on the open seams and cuffs, and waterproof shoes. The decon areas will be the 3 lines of defense. First is the pre-decon, that's a triage, to assess the external injuries. This is known as the hot zone. The decon areas for ambulatory or non-ambulatory, this is also a hot zone. The patients are taken there, or victims, after the pre-decon area. The 3rd line of defense is the post-decon. That's where the personnel that has been affected, they're dressed in gowns, and this is known as the buffer zone. What would be the body decon stop signs? Well, the first stop would be the wounds. Second, the orifices. Third would be the high contamination areas, and fourth would be the low contamination areas. There is a color scale for radiation, just like a traffic light. Red would be for an emergency patient. This patient is referred to the EM surgical and critical unit. Yellow would be an urgent patient. He's only referred to the emergency unit. And green would be the stable patient that we refer to the OPA lobby area. So in response, remember, in radiation, it's response agility. That is the key to survival.